the doctor's orders for an indwelling Foley catheter for urinary retention, and I have collected all of my supplies. Hi, my name is Heather. I'm a registered nursing student at Northwestern State University, and I have doctor's orders to insert an indwelling catheter to help with that urinary retention. Can I get you to state your name and date of birth for me? Thank you. And I see you're allergic to aspirin. Are you allergic to latex or betadine, anything like that? No? Okay, awesome. Now, do you mind if we go ahead and get this procedure started today? Okay, awesome. Thank you. So I'm going to go ahead and raise your bed. Get you up here where I can work without breaking my back. Perfect. All right. So let's just get you laid down here. I'm going to go ahead and fold your blanket down for you. I do have another cover that I'm going to use to cover you. For your privacy, we've already established privacy so that the patient is more comfortable. I'm going to lay this here. I'm going to keep folding your blanket down. Get back up there. All right. I'm going to pull your gown up so that that's not in our way while we are doing our procedure. All right. Next, I'm going to put the patient in the dorsal recumbent position. There we go. Get in there and cover you up. There we go. Next, I'm going to put on my gloves. All right, we're going to put our linen pad, saving pad down. A little bit so we have room. All right, awesome. So we're going to do a little peri-care. I'm going to get you to check the water just to make sure it's an appropriate temp. I'm going to get the side rail down for you. There we go. Get you to touch the water. All right, patient's approval. Get you to lay that there. All right, got your washcloth. We're going to wrap it wet. All right, we are going to do peri-care from wiping top to bottom, complete. All right, awesome. Still doing okay over here? Good. Going to remove the pad. All right. I'm going to remove my gloves and do hygiene on my hands. All right. Now I'm going to get my sterile environment ready for us. Into my trash bag. Stay. Come on. There we go. Now I'm going to do hand hygiene again before starting with my. So we're going to turn it this way. I'm going to open out, side to side. And then back. Now I'm going to get my gloves and put it over here. I'm going to turn my equipment to the side so I have room. I'm going to go over here. This. I'm going to lay this out. I have my one tab holding. Open it up. I'm going to get a hold of this and go in and in. Go away. Now I'm going to get my other glove. Do not move. Got it lipped. I'm going in. Thumbs out. Fingers now in. Awesome. Discard. Voila. Now I'm going to move my cabinet to right here. Next, I'm going to take the shiny side of my bed saving sterile pad down to be sterile with my patient. All right, so that's there. Gonna have to move you up a little bit there, dear. All right, got you. Gotta be able to see. Swabs out. Drop. Got my swabs here for pericare. Okay. Drop. I'm hooking my saline. Actually, I'm doing my lubricant. Drop. Oops, that was almost too low. My cap. And now I'm gonna hook this to my catheter. Going to remove the bag from my catheter and keeping my catheter in the sterile area. Okay. Drop. And I'm going to lay my catheter and my lubricant. There we go. Stay in here. And now I'm going to move. Thank you. Move this over to our patient area. Now I'm going to do the medius cleansing before inserting the catheter. I'm gonna move that over there so I can see. I'm gonna hold the uvula open. I'm gonna swipe outside down, out and over for sterile technique. I'm going to do the top to the inner part of my labia, and I'm going to come out and sterile, and then I'm going to go straight down and out, sterile. Okay, now I'm going to grab my catheter that is lubricated, and this is where I'm going to need your assistance. I'm going to need you to bear down, and like if you're voiding, okay? On the count of 3. 1, 2, and 3. 1, 2, and 3. You can urine void is notified. I'm going to inflate the balloon. Now, let's check. And we have a lock-in. I'm going to remove my saline, and now I'm going to tape the catheter to the inner part of the leg here with some slack. Pull this out, and we're going to tape it to where it's slack, so there's no damage done to the urethra area. All right, we're going to take this. I'm going to remove all of this fun stuff here. I'm going to get you comfortable. There we go. We're going to cover you back up. All right. So while that's done, I'm going to notice here that I have 150 milliliters of clear yellow, pale yellow urine output. I'm going to put my initials and credentials, the time and date that this was inserted, and I'm going to put this on the bed in a non-movable location. All right, how you feeling? Good? Okay, good deal. Now I'm going to move all of my fun stuff out of the way. This is garbage. Take my gloves off. All right. So now I just need you to, so I'm going to give you a little instructions of what we need to do now. I'm going to remove this and pull your gown down. There we go. How are you feeling? You doing good? Dropping this in the linen bag. I'm going to do this. So I'm going to need you to do drinking some more fluids than normal. And also, if you get up and have to go like x-ray or anything like that, I'm going to ask you to make sure that the bag stays below your waistline and also does not touch the floor, okay? So I'm going to put your side rolls up ×2. And I'm gonna lower your bed for safety. Here's your call bell, so if you need anything, please give me a call. The physician orders to remove indwelling catheter. So I've got my supplies. I knock on the door. Hand sanitizer. Hi, my name is Heather. I'm a registered nursing student at Northwestern State University. How are you doing today? I'll get you to state your name and date of birth for me. Okay, and I see that you're allergic to aspirin. Okay, good. I have doctor's orders today to remove your catheter for you since everything's flowing good. Is that okay to go ahead and do that? Awesome. Okay, good. So I'm going to go ahead and raise your bed up. It's going to be quick and easy. A lot easier than always putting it in. Get you up here where I can reach you. I'm going to move this table out of the way. So I've got this little drape here. I'm just going to go ahead and get your covers down first, okay? Just to get it prepared. Get you ready. Okay, there you go. I'm just going to cover you up with this here. All right, give me just a second. I'm going to put some gloves on, and I'm going to basically drain the catheter, the Foley that you have down here in the bag. And then from there, we'll remove the catheter. Just give me just a second. Okay. Put my linen saver bag on the floor. I've got my urinal down here. I have 350 milliliters of pale yellow clear urine. I'm emptying the bag now into the container. Okay. All right, capping it. And then I'm going to set it off to the side here on the, that way I can go empty it in just a moment. All right. So now I'm just gonna leave that sit right there. Remove these before touching the patient, hand sanitizing. All right, and now we're going to put on new clean gloves. Okay, so what I'm going to do is I'm actually going to put your legs in the dorsal recumbent position and get a linen saver pad. These gloves are not my friend. They're a little small. We're going to put your legs in a this side rail down. Keep forgetting that. Dorsal position, dorsal recumbent position. We're going to get your cover here so you have your privacy. I'm going to put your linen saver pad here. There we go. All right, I'm going to leave that up. I'm going to take the tape off to get your catheter easier to remove there. You doing okay? Wonderful. All right. So now I'm going to take this syringe and I'm going to insert it here. And we're going to remove this here. All right. And out we go. The catheter is intact. I'm going to take this over here and we're going to throw this in the trash. Cover the patient. I'm going to put you down where you're comfortable. Okay. We're going to cover you back up. This is going in the linen saving or linen bag. All right. And now we're going to cover you up. So what I'm going to need for you here is I'm going to put the call bell beside you. And when you get ready to have to go to the void, use the restroom, I'm going to need you to give me a call and let me know so that way I can assist you because one, you haven't been out of the bed in a minute. And two, we need to make sure that your bladder is working properly, okay? So I'm side roll up ×2 and I'm going to lower your bed down for safety precautions. And still make sure that you drink plenty of fluids.